Well, good evening, and thank you for tuning in to another week with Fathers Who Care. It's been one of those weeks, huh, T?
Yes.
It's like everything been going on at the same time, and we've been out there trying to do the best we can, and everything we doing, it's just been tedious. And I know Tamela, you getting ready to go Boston or something tomorrow, right?
Baltimore.
Baltimore?
Baltimore,
now you
Maryland.
know I was in Baltimore. I went to D.C. like a month ago, and I went over there and hung out in South Baltimore, East Baltimore, North Baltimore.
Oh,
I was over there by the river. I'm telling you, I was over there hanging out with the fellas,
Well,
right?
we're going to have to talk about some places to recommend for eating.
It's a place, it's a gyro place down there by a downtown area. Real nice area, you know.
Okay.
Just don't leave the car,
Okay.
because they'll write you a ticket. But it's a real nice place down there.
Okay.
Yeah,
We're going
but
to check out some places.
Yeah,
I'm
we're gonna-
excited about getting ready to go.
I bet you are. So what's your purpose of going down for?
I am going down there to share my journey as a
Hey, Pamela, I see you.
mother and my journey as a advocate for families, especially families who have high risk. And thirdly, I am going down there just to talk about how to reflect what is possible.
Okay, and you also got a passion about empowering some men this year. I'm going to kind of go outside the norm and talk about some things because this is Father's Day month.
It's a Men's Health Month.
There you go. Thank you, baby. Men's Health Month. Actually, it's a National Men's Health Month. So there's a whole lot of stuff going on for fathers all over the country.
Yes.
But I was really trying to come back to the fact that there's a men's health event that you're going to be working on that we're going to be able to talk about later on, right?
Absolutely.
And we're hoping to talk about women empowering men. That's the sister right there named Pamela Shields. That
Hi, Pamela.
sister, Pamela, we love you, girl. She was so actively involved in helping all the young folks and men and myself and some people that I know on the west side of Chicago. She rock. And I want to know you rock. And all of you sisters out there that's been laboring for righteousness' sake to empower some of us men. Because you know sometimes we mean well, but we kind of slow in getting there.
Oh.
All right? So
Yes.
behind every good man is a good woman, and we need the women to help us to get to where we need to go. And you know, I'm reminded of the word that say, when a man finds a wife, he got a good thing.
Yeah.
All right?
Yeah.
And that and so I'm trying to encourage you men out there that have good women and women that are out there that's got good men. How about we just flip the script a little bit and show a little love and take away that hate?
Yeah.
You know, show a little bit of love. And I mean, we all come with baggage. We all got some. But for the purpose of loving each other and loving our children and loving our community, how about we acknowledge the fact that we're not perfect? And that, you know, if we can work together, ain't nothing we can't do.
Absolutely.
And, you know, in this day and age, the reason, I was talking to my son and daughter as I was driving them through Chinatown yesterday and Greektown. You know, I was kind of exposing them to culture.
Okay.
You know, I wanted them to see the different culture of different people. And so I was asking my son the difference about certain things, and you know he was spot on, right, about his answers. He was spot on about how they're reared, how you know the discipline, all that good stuff. And so I said, so why is there a problem in our community and our folks disciplining our children? But anyway, that's another topic that we can talk about later on. This show, we're going to lighten up a little bit because I was ready to go there with it. You know, I was ready to go there. But anyway, this show, we're going to dedicate this show specifically to talking about women on the move to empower and engage men. And I know most of you women out there love a good man.
I love my husband.
I know you do. And most women out there who have a good man or want a good man want to love a good man. And so what we want to do is take this show and educate you on what we can do to make sure he's around, all right?
Yes.
You can't love him if he ain't here.
Absolutely.
And we want to make sure that as long as he's here, that he's mentally, physically, and spiritually all right. But anyway, with that being said, okay, our guest tonight is Tamela Milan. She's a community... Alexander, forgive me. Yeah, I got to clean that up, you know.
That's all right. That's all right.
Well, then you maybe need to change your ID then.
I know. I'm trying.
All right.
I'm trying to
Tamela Milan-Alexander, all right? And her husband is here too, all right?
Yes.
Is that fair?
Yes, that is fair. Thank you.
Okay. She's a community outreach worker, a community advocate for Access Community Health Network. She's faithful. She's committed. You know, every time you and I get a chance to sit down and talk about anything, you know, we go there.
Yeah.
All right?
Yes, we do.
And we really have a passion for trying to empower our people. And I'm just excited about you and the work that you're doing. And I'm excited about how the Lord has really blessed you.
He has.
I mean, how has really, literally, have blessed you. I mean, and you know, some folks toy with certain statements when they look back over their lives. You know, you really can testify about that.
I can.
And so I want to tell you, I am just so happy what you've been through and what He brought you through and what He's brought you to. And I'm going to say to you, sister, keep up that good work.
Thank you.
All right?
Thank you.
Because if we don't go through something, we can't get to something. All right? So you have to go through to get to. Yeah. So your test was nothing but a testimony.
Oh, well, thank you for that.
For your ministry, all right?
Thank you. Thank you.
Now, even though you get paid for it, boy, that's a good thing. You get paid for working at Access. It's a not-for-profit agency, right?
It is. So,
yes. And they allow you to get out there in the neighborhood and do all of this good work to empower folks and get paid for it. Tell us about who you are and what you do and why you do it, girl.
Well, as you so mentioned, I work for Access Community Health Network.
A not-for-profit, right?
A not-for-profit.
Go figure.
And we are one of the largest community health centers in in Illinois, probably the country. We have over 36 federally qualified health centers, and we offer a range of a continuum of care, as we like to refer to it, of services. I always like to tell people in the community, we make sure that we're providing all type of health services, not just within the clinic setting, but outside of our clinic walls. And what you have here is what we are putting out with your help and your support, and we're really grateful for Fathers Who Care and the West Garfield Park Youth Council for supporting our efforts with our Men's Health Matters Forum.
We'll be doing that on what day?
That'll be next Thursday, June 14th, from 11:30 a.m. to 1:30 p.m.
So we'll talk about that in a minute. And so we want you men to know that in spite of all that you might be going through, there are some women out here. That's the theme of the show.
Yes.
Women empowering men. Amen to you too, Sister Aileen. And I love you too, Pamela. But I really am excited anytime I run around or see sisters who are out here committed to empowering men. I mean, and for the most part, I think if we continue to just love each other and support each other, and don't be envious of each other, but support each other, get each other to the next level. First thing is, if you're not healthy, you may not be around here long.
Not at all.
All right. So I think I'm a proud sponsor and supporter of fatherhood events. I mean, we started off doing the men's health expos and on and on and on. So I got the years in that. So I really, anytime I hear someone embark upon this endeavor on their own, I'm really excited about that. All right.
Yes. Well, you know, one of the things that we did, so, you know, I come to a lot of our executive level meetings that we collaborate with Access and the West Garfield Park Coalition. What we've done was try to make an opportunity for people to be more inclusive.
Okay.
What we've done traditionally is to try to make sure, you know, moms have healthy pregnancies. And so mom will come into the clinic and dad will wait outside the door. And if it's not, you know, the father, whoever the significant other, they usually wait outside of that whole care. And what we're trying to do is promote more positive involvement of fathers. I mean, as we always laugh about, we don't get here by ourselves. It takes two to tango. And so we want to make sure that we're just not saying, hey, you know, mom, you know, she gets referrals and she gets care coordination and she gets all of these different social supports and medical services, and we really haven't did a great job of doing that with men. So over at Access, we decided to come up with a part of some of the work we do through our Community Action Network, which is through the Healthy Start program, which is to make sure that we have healthy babies. And to have healthy babies, not only does mom need support, dad needs support as well.
Absolutely.
We have to have dad involved. I mean, the influence that dad can have on a woman when she's pregnant and postpartum and engaged with that child throughout their life, they need good information as well.
All right.
And we are already dispelling many myths and and distortions of what it means to raise a healthy child in the community by just going outside the clinic walls, coming to meetings and organizations like you and working with you guys and collaborating to get the right information out there. And that includes bringing our dads along for the ride.
Well, and that's absolutely, and we really wanted to kind of appeal to the men, as you alluded to.
Yeah.
We've been doing this men's health, talking about prostate cancer, talking about behavioral health, talking about mental health, talking about financial wellness, all of that good stuff, right?
Yes.
For many years, and it's real important. But when we start talking about specifically African American men, they kind of slow. When it's time to go and get their prostate exams, when it's going to get their blood pressure exam, when they're going to get a colonoscopy, or all of that kind of stuff that can really save their lives, it kind of slow. They even took the prostate exams, the colonoscopies, and the PSAs. They took it down from 55 to 45. In African Americans. Now, there's always been 55 years old to take that exam. Now they done brought it down to 45 because they know they missed 10 years. They could probably save somebody's life. But we got a caller. Would you like to engage in some calls?
Absolutely.
So give us a call here, guys. We're talking to Miss Tamela, and we're talking about women empowering men, engaging men, particularly on health matters today. But we also talk about healthy children, healthy families. We want to talk about behavioral health. We don't want to talk about, have you had your test yet, mister? Yeah. And then we want to talk about some good things going on. We got the congressman doing his annual Father's Day bus trip where he'll be taking some community people and community women down to see their significant others at Sheridan Correctional Center, which I think is a wonderful thing that he does every year to bring the children and the moms down to Sheridan Correctional Center to see the babies, fathers.
They love them.
But listen, come on, let's go. Caller, you on there. Your comment or question, please.
Hello?
Hello?
Hello, Walter.
Hey, how you doing?
All right, I want to congratulations to you and congratulations to the sister, this Mary Reed.
I was just getting ready to say it. Now that's Mary. Mary is just a veteran. That's Mary Reed. She's a veteran of the West Side of Chicago, and I don't think I know too many women out here that don't love helping folks who have been formerly incarcerated, or who has had any bouts with the criminal justice system. Then Mary, she also works partially with the congressman, and she's been doing that work for many years. She worked with Family Focus when I was being groomed. Oh. She's a former businesswoman on the West Side of Chicago. So tell us what's going on, Mary. What's your comment or question?
Okay, the comment is that they passed a new law for the background. Sex offenders can't be expunged, domestic violence, DUI, and harmed animals. Everything else can be sealed. So what I put up prior together with the congressman, and he approved it, and it's been running Austin Boys. So I have over 200 and something guys that have been getting their records sealed. Some still waiting on the waiting list. So empower men, we need to get. Always been about empower men, because we get our men empowered. They can be able to take care of their children and their wives, and they can uphold the community. But as long as the white man can keep the men down, then we women got to struggle to help pull the men up. So I'm still in the battlefield. All right then, and y'all.
Hey Mary, I need some of that information that you got on what you was just talking about.
Yes.
All right then, I'll give it to you.
Okay. And Mary, listen, keep up the good work. I'm telling you, Mary, you definitely out there laboring in doing the work that you love. And I'm gonna say to you, keep on doing it, because God is extremely pleased with the work you're doing. We know you don't do it for the money. We know that.
I have a doctorate degree now and honorary doctorate.
Oh, congratulations!
Yeah. And we love you, darling. All right.
All right.
I'm right behind you.
Keep the good work up.
Keep up the good work, Mary. Thank you so much. Yeah.
And that's exactly what I'm talking about.
Now that's one of my sisters, my elder sisters, and my mentors, and she's always had a fondness for helping our community, but she always had a fondness about empowering me and pouring into my life. All right. So, but let's get on back to the comment. Now, we want to use this show tonight to bridge more fathers to be more actively involved in their children's lives and their significant others' lives. Yeah. Of course, in the community. Yes. Our primary goal is to help to reduce substance abuse, underage drinking, and violence. We want to save some lives. All right.
Yes.
Let's get you another caller. It seems like you're getting ready to get lit up in here. Come on, caller. Your comment or question for you?
I just have a question and a comment for the young lady.
Okay. Her name is Tamela. What's your comment or question?
Tamela, I want to know, first of all, I commend you for being the support that you are to men, because women, we're always getting support doing some of everything. We get a lot of support, and a lot of times men are left behind. So I commend you for what you're doing. And I want to know, what do you all do to reach out to those men that need the help? How do you reach out to them and, get them to step in? Because a lot of men won't step up when it comes time to going to the doctor and this, that, and other. How do you all reach out? And is there a way that you can make a comment for men that are watching the show to be able to contact you all to get the help that they need?
Okay, so thank you so much. You know what I'm going to do? I'm going to take a liberty. And she asked the question. You heard her, right?
I did.
So let's do this. Go ahead.
Let me answer you by saying thank you for your question, and thank you for your encouragement. One of the things that we want to do, and it was just up about our Men's Health Matters Forum, we want to be able to make sure that we are bringing the resources outside of the clinic so that we can bring them into the clinic, if that makes sense. In order for us to make sure that we are getting the word out, I'm on this show. I go to a lot of different community-based events and community organizations, and we want to make sure that people are aware of what we're doing. See, sometimes it's about awareness, and so right now we have a Men's Health Matters Forum. It's going to take place Thursday, June 14th, from 11:30 a.m. to 1:30 p.m. right over there at Austin Town Hall, right off Central and Lake. And excuse me, we're going to be having resources and services around employment and vocational services, behavioral health, medical benefits. We will actually have someone on site that can sign them up if they don't have health care, and some self-care activities. One of the biggest things that we need to start doing is realizing that men need to take care of self as well. Just like we have an opportunity to take care of self as women, and we have an array of different services and things that we can do to take care of self. Sometimes I don't believe our men or our male population has that same opportunity. So we want to make sure that we're bringing all of these great folks that we've invited to be guests and speakers and vendors all together so that the resources are there. We're not asking them to come into the clinic, but if they come and get these resources, what we're hoping is we'll bridge a gap between them and getting into healthcare and really being able to get healthy so that they can be healthy for their children and their community.
Yeah, so what we're talking about today, we really want to kind of tailor this show. This show has been tailored, I should say, on to empowering men today.
Yeah.
It's not that we're against women. I think we celebrated you all last month. We love you every month.
Yes.
And every day.
We appreciate it.
But we'll take this month, all
Yeah,
right?
yeah.
We'll take this month as for June to be National Men's Health Awareness and Appreciation Month.
Yes.
So when we're doing that, we want to tell the men today, that we know in spite of what you might be going through, we know that you might be suffering from some other issues, and you might be traumatized, you might be in need of some crisis intervention support. We got that going on.
Yeah.
We want to talk about some behavioral health issues.
Yes.
I mean, we know you're not crazy. We just know you need a little support.
That's it.
All
And
right.
that's it.
And we all need a little
Yeah.
support.
Yeah.
So don't look down on support. We all need it. But what we want to do specifically, Tamela and I, along with Access and Fathers Who Care in the West Garfield Park community, stakeholders and young folks, we're coming together to promote this Men's Health Matters. Men's Health Matters. So we want to get men together and let men know that your health matters. So what we're trying to encourage folks who are out there, if you got a significant other, which I know you do, encourage him to come on out here and join with us on June 14th, where we're going to be talking about how we can empower men. And we'll be doing another event in Loretta Hospital, and you'll be there with us again. It'll be our
Absolutely.
annual 6 or 7 year,
Yeah.
where we'll be
Been doing it 3 years with you guys.
Yeah, and we have a wonderful time.
Oh, it's
where we be doing
absolutely
other health
phenomenal.
screenings and men's health events. So
Yeah.
it's something that we really committed to. This thing that kind of speared out of the stuff that we've been doing with our congressmen, with the Fathers, Family, and Public Policy Task Force of his. And I want to also encourage those to keep praying for the congressmen and those who will be traveling this Saturday to Sheridan Correctional Center with the babies and the baby's parents, mothers, to go down there to see their significant others and the baby's fathers. And I want to encourage the congressman and Sharita and all those good people for the work that they've been doing. Keep doing the good work. I'm telling you, that's a bang-up thing that they do. I've been with them before. I mean, they go out there about 7 o'clock that morning. They stay out there all day long. It's a long day, all right?
Okay.
But it's a worthwhile day. Because they have a chance for the families to come together in the visiting room, the children, the mother, the father, and they all join together. They break bread together. Then the warden at the correctional center allow us to take the men off into the campus, and we can have workshops with the men, and the women be having workshops with the women with the women that the congressman bring down. And I'm just telling you, it's a bang up job. I mean, the men are really appreciated. Then congressman has created resource directories, so when the guys get out of the facility, they got resources. So after they come back from this event, then we go over to Geo Reentry Services over there off of Fulton, and we break bread, and we hang out over there all day. All right.
Yeah.
So it's really a fun thing. So I just want to encourage you guys to be a blessing to someone else. One more time, give us an overhead on this here, please.
Yes, don't forget, next Thursday from 11:30 to 1:30, we are going to be at Austin Town Hall celebrating Men's Health Matters Forum. And we are so appreciative of the work that we've been able to do to get this out. And all your support has been just amazing.
It's my pleasure.
And we just want to make sure if you have someone who has a need for services, has a need to be empowered, who has either something to give or want to get some great, informative, tangible information, please join us next Thursday. We appreciate if you come. And all we want to do is make sure that our men in our community recognize the importance of their health. We have so many things that are happening in our communities, and male engagement, as we like to refer to it in Healthy Start, is one of the ways we try to do that. And this is where this sort of sprang from. And I've been very appreciative to join you in many of your events with the annual fatherhood events that you guys do. But we really want to make sure that we're really trying over on our side to get dads involved.
Teamwork can make the dream work.
All the time.
So listen, in closing, we have to go right now, but I want to also send my condolences to the family of Attorney Lou Myers, Tina and Louis Myers III. But this Friday we'll be doing the Lou Myers We Line in State at Leakson Funeral Home at 7838 South Cottage Grove. Please come by between noon and 12 and show your respect to the elder Louis Myers on his transition. But then on Saturday, June 9th at 1:30. From 1 to 1:30, the doors open, I believe, about 1 o'clock. At Christ Universal Temple at 11101 South Ashland, we'll be having his memorial service. So keep the family lifted up and keep those who are going through. He's not the only family. We want to lift up Zerlina.
Yes.
And her baby's father, and we want to lift up Angela and other folks who are who are experiencing some hardship this week. But listen, God bless you all. We want to thank you all for what you're doing. And there's another term out here, compassion fatigue. That's meaning when you care for somebody so much that you just burn yourself out. Don't let it happen to you, all right?
Anyway,
join us. We'll talk to you soon next week. So God bless you. God keep you, and we'll talk to you on the other side. Until then, good night. God bless. And keep the faith, and we'll see you when we see you. Bless you now.
Thank you.
Thank you so much.
Thank you.